Hey everybody, it's Dr. Davis. So I had a question in the discussion board, and I wanted to just go ahead and talk about that for a second, as well as remind you to please remember to look at your medications that we talked about. We talked about oxytocin, we talked about vitamin K, we talked about um, what else did we talk about? Erythromycin for our babies. Sorry, I'm looking through my papers here to make sure I hit them all. Glucocorticoids. So we didn't talk about that one a whole lot. So I'll go ahead and mention that one first. So our glucocorticoid is betamethasone. This medication is given to try to help mature babies' lungs. So if mom comes in labor and is preterm, usually less than 35 weeks. We will give mom a dose of betamethasone, your glucocorticoid, and that's an IM injection. So we'll give her one injection and then she gets the second injection in 24 hours. So the idea is to try to mature those lungs a little bit quicker. Um, so that's one of the things that we do for our preterm labor moms. So when we talk about oxytocin, so remember that medication and many of the medications that we give in obstetrics are really used for the same general thing but different. Okay, so what do I mean by that? So in labor, you might be getting oxytocin in very minuscule amounts, very small amounts, to help increase contraction strength, make those contractions closer together, make them harder. Okay, but then after I'm going to actually give a bolus of oxytocin, and that is to, while it does the same thing, right? It still is going to contract that uterus, but we want it to contract that uterus a lot, and to help decrease the bleeding. So, I wanted to mention that as well. So the other thing I wanted to mention was the question that was brought up in the discussion boards. It was about getting mom up after delivery if she's had an epidural. So I want to pose the question to you, and I want you all to think about it. So if we did talk about epidurals yesterday, and what did I tell you about how long it would take for mom to get the feeling back in her legs? So we talked about that stage 4 of labor, and that lasted for about 4 hours. That's the recovery. And it usually takes about that long for mom to get feeling back in her legs. So let's think about our patient. So she's delivered a baby and lost a massive amount of fluids. I'm just going to say fluids because while that's blood, but she's also lost amniotic fluid. She's had a baby. The placenta is gone. So there's lots of changes that have happened in her body, right? And then I have an epidural too. So what would be a huge consideration for this patient before I get her up out of the bed? So think about it for a minute, and then I will tell you my answer. Okay. So as I'm getting ready to assess this mom, any mom, now I will say, even if the mom did not have an epidural, I still have to have, this is my number one thing I have to think about when we get ready to get her up. And that has to be safety. Okay. The last thing you want to do is get a patient up that just delivered a baby and not make her sit on the side of the bed for a little bit first. Make sure that she's not dizzy. You don't want to get her halfway across the room towards the bathroom and her pass out. You don't want her to get her into the bathroom and sitting down on the toilet and pass out. Okay, those are bad things. So we want to give her a moment. So the first thing I'm going to do with any of my moms is make them sit on the side of the bed and dangle their feet, right? We want to make sure that she has feeling in her feet. She doesn't feel dizzy, lightheaded, any of those kind of things. All right. And then we'll slowly get her up into the bathroom. So if my mom has had an epidural, now I need to add to that that those legs might be numb. So she might feel like, oh, yeah, I can feel my legs. But I can tell you, many, many times we'll get her swung around and she stands up, and the next thing I know, she goes straight down to her knees. Okay. So, because she doesn't feel her legs like she thinks she feels her legs. Okay. So, safety is the number one thing that we have to think about when we're thinking about our patients. So, we want to make sure that those legs are moving around and that she can feel them in order to ambulate to the restroom. Now, what do we do if she needs to go to the restroom and she can't feel her legs? We can always bring in a bedside commode and just do, pivot her just like you would someone who maybe had a broken leg or a hip surgery. Just pivot her up and over and down onto that bedside commode. And then you can help her do some peri-care, get her bed cleaned up, do a bath, those kind of things there at the bedside. So those are some important things. Let me just add to that. I never let a mom that's getting up for the first time get in the shower, because if they get in that shower with the hot water and this is the first time I've gotten up, they're going to pass out. Okay. Just a happy, healthy, friendly tip from your neighborhood OB nurse. So any other questions, please post them. I will try to answer them throughout the weekend for you. Of course, you can always email me, but I will see you on Wednesday.